Right now, parts of the U.S. are experiencing a COVID uptick. Many people have likely experienced the uptick firsthand or know someone that has it. Nearly 40 states are reporting high COVID activity levels, including North Carolina, because a variant is spreading. The CDC says emergency room visits are at their highest for the coronavirus since February. Dr. Christopher Uhl, an infectious disease expert at Atrium Health Wake Forest Baptist, spoke with us about the summer surge and how it's impacting North Carolina and the Triad.
It depends a little bit where you are in the United States. If you're on the West Coast, in some communities, this summer surge is a little bit higher than last summer surge. Here in the Triad and in North Carolina, it's not as high.
Dr. Uhl says after reaching a peak about 1 to 2 weeks ago, cases in some areas of the Triad are already decreasing. Experts say we seem to do okay with the midsummer surge. But what's causing a summer surge in cases? Experts say they don't know 100%, but it likely has to do with the timing of new variants.
For some reason, COVID's always had this summer surge. And it probably has something to do with that as the new variants come up, they usually come up right before the summertime. So we have a new variant that is a little bit better at evading immunity, and oftentimes they're a little bit more infectious. And this is also a time when people travel a lot. And when people travel, they get together and they share their viruses amongst each other.
Experts say the reason we don't feel the surge as bad this year, many of us having immunities, many of us have either had COVID in the past for being vaccinated.
So we have all a bunch of antibodies in our body, and our immune cells are all fired up and ready to combat COVID if we're exposed. The other is that the variants that are going around now, the so-called flirt variants, and that reflects two separate and different variants, are a little bit milder than the ones that we've seen in the past.
Experts also say we are seeing less severe cases, but it's still important to take precautions because people over the age of 65 or people who are immunocompromised can still get severe cases of COVID. So what can we do to protect ourselves? Experts say that hasn't changed much.
Good hygiene, wash your hands a lot, particularly before eating, after using the restroom. If you're in areas where where it's crowded, such as an airport, traveling this summer, you might want to put a mask on while you're there, and that could help protect you, particularly if you're older or immunocompromised.
Experts also urge you to get the new boosters that will be out this fall. In March, the CDC officially lifted its recommendation that people with COVID stay home for 5 days. Now the center says 24 hours after symptoms have subsided is enough. Once people resume normal activities, the CDC encourages them to take additional prevention strategies for the next 5 days to help make sure it does not spread. They suggest going outdoors more, enhancing hygiene practices, wearing a well-fitting mask, keeping a distance from others, and or getting tested for respiratory viruses. Experts say as we get into the fall, cases will likely go back up during our respiratory viral season, which starts in the second half of December.
So as the summer goes on, our numbers will come back down again, and I think just like they have in previous years. And we'll get into the fall and then winter. And then when we get into our respiratory viral season, which starts in the second half of December, getting into January, our numbers will come back up again, not only for COVID, but also for flu and for RSV and our other viruses.
And as for the flu, we are told it's at a very, very low level this summer. They don't expect those numbers to rise until late fall or early December.